everyone. We at Sugar take a lot of time to find out what's plaguing our readers. And while doing our research, we came across a couple of questions that women don't or feel embarrassed to ask their doctors. We decided to go ahead, help our readers, and compile a list of questions that you should be asking your GP. Let me introduce you to Dr. Chhavi Mehra. She's a doctor, an internal medicine specialist from the California Board of Medicine and the quality head of RxDX group of institutions and hospitals, Bangalore. A GP par excellence, someone whose diagnosis is always bang on, and a doctor that I can personally vouch for. Thank you, doctor, for joining us today. So my first question seems to be a rather simple question, but it seems to puzzle a lot of women out there. What is the ideal duration of a period?
There is really no ideal duration, but anywhere from 3 to 5 days is considered as normal.
Oh, okay. So 3 days is fine and 5 days is fine. Is that what you're saying?
Yes.
Wow. So that's for you readers. 3 to 5 days is okay, is the normal duration of a period. My second question is around a problem that a lot of women seem to be facing today, that is osteoporosis. It seems very widespread. So what could we do at our age to prevent it at a later stage?
Osteoporosis, it's a disorder in which our bones become more lighter weight, so we lose bone mass.
Okay.
It is not a joint disease. Most patients come to me and they say that osteoporosis is arthritis, my joints are hurting. It's not that. It's your bones becoming lighter, so the calcium deposition in the bones become less over time. It usually does not happen to us till we lose our estrogens. So our estrogen hormone in our bodies during our menstruating years keeps our calcium cycle pretty good.
Okay.
And so most women will become osteoporotic only after menopause.
Okay.
So being physically active, doing weight-bearing exercises, a walk every day, all helps not to develop osteoporosis. But I'd also like to say something very important is women who take thyroid replacements tend to get osteoporosis early because thyroid hormone itself is a hypermetabolic hormone.
Okay.
And that causes the movement of calcium deposition in our bones not to be stable, and as a result of it, such women can get osteoporosis early, and they should take their calciums while they're taking that thyroid replacement. And it's a very common thing to take thyroid replacements, and that's what happens.
Okay. So if you do have a thyroid problem, then please do take your calcium supplements, and there's no excuse for not exercising. As Dr. Chhavi said, you need to take a walk every day. Let's move on to our next question. Doctor, we know we all lead very unhealthy lives today, and there seems to be a queue. I mean, I waited a while for this interview to happen because you had so many patients. What are the health concerns that a majority of your women patients today are facing, and what do you think can be done to avoid it?
The single most important medical concern I have for women from young adults to women is obesity. Obesity leads you into PCOD, which is polycystic ovarian disease, insulin resistance, diabetes mellitus, and I think that is one very, very important factor that needs to be addressed at a very young age. Other diseases that I see women for are hypothyroidism. I see them for depression.
Okay.
So these three make the more obesity, depression, hypothyroidism are three things, and they could actually all be linked. But I won't go to this interview and explain to you how they're linked.
Okay.
But these are the most important problems, and I'm telling you, exercising, the right diet, and keeping your weight under control is one of the most important factors in all of these diseases.
Okay. Are you saying that all of these can be avoided? Definitely.
Absolutely.
If there's no genetic predisposition?
Absolutely can be avoided.
Okay.
Even hypothyroidism, more and more research is telling us how if we start treatments like yogas, breathing, at a very early stage, they can be controlled. I don't think they can be cured, but the amount of drug that we are giving to someone, then the dose can come down. And the lower the dose, the less the side effects.
Wow, really interesting. Thank you, doctor. And this question kind of leads in from the previous question. I've also been reading up a lot on women having a lot of vitamin deficiencies. That also seems to be a major concern, and people seem to be popping supplements left, right, and center. So, do you think that even a vitamin deficiency problem can be avoided, and if so, how?
So let me first start by addressing deficiencies, not just vitamin deficiencies for women.
Okay.
And the most important one is iron. So I'll have a woman come to my office and tell me, I'm not deficient, my hemoglobin is 12.5.
Okay.
Hemoglobin has nothing at all to do with iron deficiency.
Okay.
You need your doctor to measure an iron and transferrin saturation, ferritin, and that determines your stored iron in the body.
Okay.
That is what determines those hair falls, those under eye bags,
Okay.
and that is lost every month in our menstrual cycle.
Okay.
So before we ask fancy vitamin D and B12 levels, a woman should be requesting during her menstruating years for an iron level, not hemoglobin.
Okay.
Okay? Now, vitamin D and vitamin B12 are equally important, I should say. In India, we have an issue with our melanin skin
Okay.
to absorb D from the sun.
Okay.
And as a result of it, we are having D deficiencies. In Western countries, there is fortification of milk, juices, food with D. And they get it enough. We don't get it enough. So 80% of patients that walk through my room have vitamin D deficiencies. Now, vitamin D is an inert component of the mitochondrial function of our body cells. And mitochondria are the energy storehouse and breathing mechanisms of each cell. Just imagine every cell of our body gets affected with vitamin D deficiency. It could be lungs, so we can get easily asthma. It could be skin, and we can get a skin condition. It could be anything from skin to lung to heart to diabetes that does get affected with vitamin D deficiencies. And also hypothyroidism also gets affected with vitamin D deficiency. So we all have to work towards asking our doctors to check for that. Most yearly health checkups don't have levels of vitamin checked in there because the costs are a little high, so the people don't want to put them in the packages. So go ask for it every year.
Okay.
Vitamin B12 is another one. It's mainly for vegetarians.
Okay.
People who do not take non-veg will have vitamin B12 deficiencies down the road. People who take non-veg can also have it because sometimes our intestines don't absorb it. And vitamin B12 is as important as D for our nerves, for our memories, again for our hair. So I would recommend iron levels, B12 and D for all women.
Okay. That was really interesting. It felt like a super easy science class. Thank you, doctor. And we're now moving on to a slightly more different topic. That is for our readers who are sexually active. I see a lot of people popping in eye pills like they're contraceptives. And thanks to you, I know that it's not healthy to pop an eye pill. But how many times is okay?
Once a month, once in a cycle.
Okay. Once every cycle.
Okay. It's the safest. We would prefer once every 3 cycles.
Okay.
Because it has a whooping dose of hormone.
Okay.
And that can affect your cycles down the road. And
Okay.
you don't want that.
Okay.
So it's a good idea
Okay.
to not ever take it more than once in a cycle.
Okay.
And if you can prevent, once in 3 cycles would be good.
Okay. And while we're on this topic, what about screening? How often or when should one get a pap smear and a mammogram done?
Once you're sexually active, preferably once in 2 years. Okay? The first 3 years of the pap smear should be every year. And if you have 3 normal pap smears, after that, once every alternate year. And this is by the American Association of Oncology that determines preventing cervical cancer.
Okay.
For people who would like to know what pap smears are, they're basically swabs that are taken from your cervix around your cervical area, and a slide is made and we look for abnormal cancer cells. This prevents cervical cancer. Mammogram is a test which is done by 2 means. One is radiation mammogram and one is sonomammograms. Radiation mammograms is quite a bit of radiation. Sonomammograms have no radiation. Together they actually give you 100% result. But saying that, I would prefer all women in childbearing ages under 40, even if they have a family history of cancer in their mother or on the mother's side of the family, aunts or sisters, and we start their mammograms at the age of 35. But they're childbearing, they still have eggs that they produce. So we do not want to do radiation mammo. I would prefer they do ultrasound mammograms.
Okay.
After the age of 42, or let's say 40, let's use it, once in 2 years is what the American Association of Oncology says. And I would prefer personally that a woman does a radiation mammo every alternate years and an ultrasonogrammogram every alternate year. So in 1 year you do either the radiation or the sonomammos.
Okay.
Don't do both, and then just alternate that and do it throughout, please.
Okay. My next question is also around screening. Hardly anyone gets screened for sexually transmitted diseases, although they are sexually active. So when would you recommend that you get screened for STDs?
I think this was really a very, very important question. I feel sad to say that young girls visit doctors' offices for burning urination or burning in their private parts, and they leave their offices without a single discussion of sexually transmitted disease. I think it is one of the most important discussions that a physician should pick up with the patient. So saying that, the screening should start as soon as a person is sexually active. Okay? There should also be education given on protections. Okay? Now, HPV, which we're talking about cervical cancer, you can screen it by doing pap smears, right? Then there are HIV, then there is hepatitis B. These are simple blood tests. Syphilis, which are all blood tests, they're serum tests, they should be done every year after you're sexually active. They're very, very important.
Okay.
And any time a patient complains of discharge, a testing for gonorrhea is must. And there's another sexually transmitted disease which is very not taken care of, and that's chlamydia.
Okay.
And similarly, people get discharged, they have a low-grade fever, they have a burning sensation, they need to bring it up with their physician. The physician also should be responsible to bring the discussion up and not leave it like it's a urinary tract infection, because this is more than that.
Are you saying the onus lies both on the patient and the physician?
Absolutely.
In the case of this question?
Absolutely. But in India, for the patient, it's actually harder sometimes to discuss this, and our culture doesn't. So it's the physician's responsibility, I feel, more to discuss it each time the symptoms are there.
Wow, that's really interesting. Our readers are between 18 to 35, the readers of our online publication called sugar.com, and I wanted to know, because you've given me so much of advice on so many occasions, and you're the kind of person one feels free to just come to your office and talk to you about anything. So I wanted to share that with our readers and the rest of the world. What is your personal advice to girls in the range of 18 to 35, or what is your personal message to them?
My personal message is to lead a very healthy, mindfully aware life where there is a balance between intake. I really believe that keeping yourself physically fit, eating right, sleeping well, with the generation staying up late at night, you're inhibiting your hormones that heal your body. Sleeping on time, getting up on time, eating well, doing your work with passion, and being very, very careful in your relationships is very, very important advice that I like to give to all girls from 18 to 35. That's it.
Wow, that is the best advice, and if you see Dr. Chhavi, you can see that she practices what she preaches. She doesn't look her age at all, and she's beautiful both inside and out. Thank you so much, Dr. Chhavi, for taking this time to spend with us today. Thank you so much. To all our readers, we really hope you enjoyed this interview. If you did, please hit like, subscribe to our YouTube channel, like our page on Facebook, and for more such updates, stay tuned to sugar.com. Thank you and see you soon.